Hi. Okay. Well, I'd like to welcome everyone. Thank you for joining us on this rainy March day. We are very lucky to have with us to present today. It's Chloe. Chloe, help me with your last name.
Guazzone is fine.
Thank you. She's the executive, I'm sure you all know, but the executive director of our wonderful health center, the Anderson Valley Health Center. And Chloe has just been a delight, breath of fresh air coming into our valley and into the health center, and it is just blossoming. And she's hopefully going to share with us some of the ways that she has helped it blossom. And we've got some questions already that we've collected. But if you have any questions, please jot them down in chat, or at the end of the presentation, people will probably have an opportunity to talk. Meanwhile, if people can start with mute on, that way background noise will be limited. So Chloe, would you like to begin? And
Sure. So thanks for having me, everyone. And it's been a while since I came and talked to your group, so it's a pleasure to come back. And hopefully I don't repeat too much that all of you already know. I think we should probably start with just kind of an overview of the health center and where we've come over the last, well, it's been over 5 years since I've been there now. And then maybe we can jump into COVID. I'm sure there's going to be a lot of questions about what's happening with vaccines and testing and travel and, all of that. So does that sound okay to everyone? Okay, good. Well, so the clinic is doing well. I'm happy to say that even with this crazy year that we've had, we've still managed to keep all our programs going. We've managed to do a remodel, actually 2 remodels, finish one, and we're almost done with the second one. So I'll talk a little bit about that. And we're starting on another one. So we are keeping our kind of eyes forward despite all the craziness and diversion we've had to do to bring COVID testing and COVID vaccinations to the Valley. So quickly, I'll just say that, when I came to the health center in 2015, I think we were starting to outgrow that building a little bit, which was a surprise to everybody who worked on the capital campaign. Before, I was there, I think nobody ever anticipated that we would grow into the big remodel that you all helped do. It's a little over 10 years now, 10 or 11 years or so. Oh, and I'm going to just apologize ahead of time if my kids interrupt. They're running around the house. They might come in. But we are outgrowing, and some of you may know that, we were super slim on kind of the administrative side of the health center. And I think, there was good reason for that a while ago, but at the same time, in order to become what we call a patient-centered medical home and to really make sure that we were able to, kind of wrap our arms around patients and do whole person care, we had to provide some of these other services, which we are now providing. So one of them is kind of behind the scenes. We added a quality improvement coordinator, and that was just a huge change to the health center. Her name is Marcel, and some of you may have seen her in the vaccine line. She's been instrumental in making sure that everybody, their labs are followed up on, their referrals are followed up on, we're all doing preventative care the way we should be. Everybody's getting colorectal cancer screening and pap smears and mammograms and all of those kind of essential preventative medicine pieces, which, we're measured on, but of course we also want to, the main thing is patient-centered medical care. We want to make sure that even when people aren't sick, we're taking care of their needs. So our QI coordinator came on. She's been with us probably about 2.5 years now, which has been really wonderful for the health center. We've also added a lot around case management and health coaching. And some of you probably know about Sid and Leah and all they're doing for the health center. We still have our school programs. So even though school has been remote, we've been offering reproductive health via Zoom, which is interesting. It's like crickets, I hear, for Sid, who's been teaching on Zoom to the high schoolers, but we're still, we're still teaching it. So, and then Leah has been kind of, she's been pulled aside a little bit for a lot of the COVID, because it's taken a lot of effort to do a lot of contacting. You could do that. Contacting patients for vaccine appointments, and you know how that's been going. It's kind of reaching out to the newest group that's eligible. But before that, Leah and Sid were hired as kind of a 2-woman team to do health coaching. And I think there was a question around health coaching and what exactly that is. And so we started out, we have Wes, who's a nurse, and he's doing kind of the intense case management. And that's for people who have both mental illness and possible physical disabilities. And so he's doing some, kind of dual diagnosis case management. And that is helpful. Hang on one second. Sorry, my daughter sitting here with her iPad. So in addition to the mental health that they receive, so we have 2 psychologists. We have one LCSW who's bilingual, and then we have a telepsychiatrist. In addition to that behavioral health therapy that people can get, we have Wes, who does kind of the weekly case management. So for those patients that really need just an extra contact, he's able to call people weekly or monthly, depending on what their need is, make sure that they're getting to appointments, help people filling out paperwork, things like that. And then for Leah and Sid, they're doing a lot of case management for diabetic care. So people who need nutritional counseling or need help setting goals around fitness activities or nutritional goals, they are able to meet with people on the schedule that people want and set health coaching goals with them around that. And that's all kind of tied into their medical care. So, we have integrated services. So we have weekly meetings with all of our medical, behavioral health, and dental providers. And so if there are cases that are crossing into departments, we talk about them and how to best serve the patients. So I think that kind of sums it up for health coaching and case management. Are there any questions about that particular service? Okay. And then you may have known we added acupuncture. And then, we added acupuncture. She really was getting going. She had a full caseload, and then COVID happened and we had to kind of shut down acupuncture for a while. This is Ollie, my son. So she just has kind of resumed, care with all the COVID protocols. So she's, we've got an air purifier in the room, and she's doing now 45-minute sessions instead of an hour with, this kind of 15-minute deep cleaning in between and airing out of the rooms, windows open, all of that. There are some kind of strict coding processes, in place for what covers acupuncture. So I believe for Medicare, it's pretty strict. It's down to like low back pain. So it is, we do have a lot of people that are private pay for acupuncture, and we do, hopefully everybody knows we offer a same day 30% discount for same day payment. So if people are doing private pay for any service in our building, if it's over $50, we offer the same day discount. So that's good to know. And of course, I hope everybody knows we have a sliding fee scale, right? So, I mean, if you're not on Medicare, you're not insured, people are eligible for sliding fee scale if they are under 200% poverty level. And we would love to add chiropractic. We have no room for it in the building. So that is why, I mean, that's not why, it's one of the many reasons we're looking at expanding our building. And I see Steve Wood there. So Steve has been helping us fleshing out and developing the design for the new building. Why don't you go with Amalia? And so chiropractic acupuncture, we got federal grants to add the alternative medicine, and a lot of that started out for pain management for people who were like what HRSA defines as substance use disorder, people who are on chronic opiates for pain management. But the good thing is Medicare and Medi-Cal kind of followed along with that and started covering more and more services for both acupuncture and chiropractic. So for example, pregnant women, we can now treat and get reimbursed for acupuncture. Any questions about that? Okay. And then, I mean, hopefully all of you know, we offer, yes, 200%, it is low. Yeah. That's what we're mandated. We're not mandated. We extended up to 200%, and HRSA's requirement is 200% and below for sliding fee. Yes, we just. I'm just responding to some of the questions that are popping up in the chat. So the question is, do you offer pain management? So yes, we do in different forms. So you know, our medical providers can handle pain management. We usually like to integrate people who are being treated for pain management into our behavioral health department or our acupuncture department. And then for people who are who have used opiates for chronic pain, we have really tried to get as many of them off of the opiates and onto what's called Suboxone. And that's just, it is an opiate, but it's a medication that has another medication inside of it that prevents overdose. So it's a safer medication for pain management. I see, Judy, do you have your hand up? Oh no, maybe that's my, never mind, sorry, that was my mouse that turns into a hand when I hover over you. Sorry about that.
How do I get the chat thing so I can send you a question?
You can, down in the bottom of your, you can ask me a question too, and then if you want to just click on the chat down when you in the bottom of the bar, there's a little button that says chat.
Oh, I see it. I didn't have it up. Thank you.
Yeah, sure. Okay, any questions so far? Okay. So, and you know, with the health center, we have always struggled with staffing and sustainability in our department. So I'll just mention that over the last, 5 years, we've really tried to build up our department so that we have some sustainability. When I came on board, Mark was our only physician, and then we had Cindy, our nurse practitioner, but we were all really worried about, what happens if your physician needs to go out on leave or can't oversee the nurse practitioners for supervision. And so we did hire we've had kind of, many physicians come and go over the last 5 years, but we have Dr. John Rocha, who is an internal medicine doc who joined our team about a year ago. And he has a wealth of experience, particularly in oncology. He was doing oncology care on the coast for many, many years before he came to us. So we've got now 2 MDs and still 2 family practice nurse practitioners, which are Louisa and Cindy. So 4 medical providers. We are challenged in dental. We, finally hired a second dentist, and then she had an injury that happened about 2 months after she joined us, and so couldn't stay with us. So we are recruiting for a second dentist now. It's been really tough. I'd say dental is, our biggest demand department, and it's so hard to staff. It's really, really hard to find qualified people to staff that department. And then in behavioral health, I think I mentioned who we have for behavioral health. And we also have really worked hard to get bilingual people in every department, because we had, we have bilingual, all our front desk staff are required to be bilingual, but and a lot of our MAs are bilingual, but our providers weren't all bilingual. So we're working hard to get bilingual people, and we have a bilingual LCSW who can provide mental health counseling. Okay, there are some questions in the chat, so I will look at that. Let's see. Could you review the fee schedule for acupuncture if you have Medicare and supplementary insurance? So I think this question is around how much would a visit be for acupuncture if you have Medicare and supplementary insurance? Is that right? Am I reading that right? Okay, I'll just answer it as if it's that, and if I've got it wrong, let me know. It depends. So the first visit acupuncture is more expensive than the second visit acupuncture, and you know, because there's an initial, and then your follow-up visits are usually a little bit shorter and kind of routine, and the initial includes the assessment. So the initial, I want to say, is quite expensive. It's like I want to say $185, but I'm not positive on that. And then the follow-ups are somewhere under, you know, around 125 or something like that. I don't have the fee schedule right in front of me, so I can, Donna, I can send you exactly what those costs are after.
Well, I can actually answer that because I
Oh,
have been.
good.
So the Medicare, if it's lower back, is the one thing that is covered
Yes.
here. And at this point, actually, I don't know, they're billing it, and then I'll find out if there is any fee. If it's not lower back, then it's $59 a visit with the discount, with the same day discount. So I don't know what that
So that puts
translates.
it at 85. I think it was 85 for a 45-minute second consult, and then slightly
Okay.
more for the first. That's right.
Yeah.
Yeah. And Medicare, so like I said, you know, Medicare will only cover the lower back pain. So, you know, if you've got that and something else, you know, ask the medical provider to code it as lower back pain when they refer you for acupuncture, and they will do that for you. And the supplementary insurance question, I'm not really sure, you know, I mean, this is one of the hard things about our health center, is that most federally qualified health centers don't all take private insurance. And we do, but it is definitely a struggle because all the different private insurances pay different things and allow different codes and don't allow others. So I would have to kind of, if you had a specific question about that, you could always call me at the health center and we could ask the insurance company what they would cover. And then, okay, so the question that we get a lot is about physical therapy and or workout facilities in our remodeling plan. So we have analyzed this, you know, kind of up and down, whether we can make physical therapy work in our facility and how much demand there is over the year. It's really hard to pencil out, but what we've done is, because, and Heidi can talk a little bit about this too, we've talked about different models and ways that physical therapy could still come here. You know, if we had like an independent physical therapist who came and we did some billing for them, or there's a lot of different models where we could see maybe physical therapy working. And so what we have right now designed into the expansion is a flexible space, a big room that can be divided into office space if we never use it for physical therapy, but a big room in the hopes that someday we might have exercise equipment and be able to get a physical therapist to Anderson Valley. Okay, and then there's another question. Case management available for patients who have long-term health care policy and request local nurse case manager to comply with policy requirements. I'm not sure. Okay, so it sounds like possibly this is a healthcare insurance question where nurse case management is required to reimburse some type of service. I would say that's probably a question for the provider to answer. And we do have nurse case management. So, you know, we have Wes who does direct case management, but I'm not sure what type of case management the question is referring to. So that, again, I would probably either reach out to me and I can learn the specifics of that question, or ask your provider at the health center if we could meet those requirements for you. Does Medicare pay for massage? You probably know this better than I do. I don't think so, but I'm not sure. No? Yeah. So like our acupuncturist, for example, she does some massage in combination with her acupuncture. And I know that what she gets reimbursed for is the needling. She doesn't get reimbursed for the massage portion of the visit. Okay, and then who's trained in reading x-rays? I did see that question pop up. So only Mark is trained in reading x-rays. And it's interesting, this has been a big shift in the model. Like, Mark comes from a time when the docs did everything. They did OB, they did, they rounded at the hospital, and we are so lucky to have Mark and have a doctor who's still doing all of that, because now, we have residents that come and, they're kind of interested in specific training. They're not necessarily interested in getting all of that extra training. And x-ray was one of those things that was just like, Mark wanted x-ray because it was available, so that he could make it available in the Valley, and nobody else is really interested in getting it. So I don't know whether our x-ray services are going to stay. We do about 65 x-rays a year. And it is, usually for somebody who's had an urgent care injury, to kind of figure out how bad it is and whether we need to transport them. And then they get re-x-rayed in Ukiah. So only Mark is the answer to that question. Any other questions?
Could you elaborate a little bit on what the remodeling is that you're doing? I'm not familiar with it.
Sure. So we actually got $1 million grant from HRSA, from the federal funders, and we are basically going to double our facility. So I talked at the beginning, about how we've kind of added these supplemental services, and we've also added therapists. So we are looking to add 8 new office spaces, and also a private office for teen clinic. So our teen clinic, I don't know if you know, we remodeled our dental clinic recently and eliminated 2 of the hallway offices, one of which was the teen clinic. And that was to give more office space to the dental team, which has grown. So the teen clinic, we're looking at kind of putting in the back of the building with a private entrance, so that our high schoolers, don't have to kind of walk through all of our staff to come and see us. And then behavioral health, we have also expanded in telehealth. So we've added a couple rooms for telehealth, and we hope to keep expanding telehealth for specialty care. Right now, we are only doing telepsychiatry, but we are working on a pilot project for pediatric specialty care through UC Davis. And that would be via telehealth. So pediatric cases who are kind of more complex cases, our providers would be able to open the computer and talk to a specialist in the UC system, and then determine whether they can treat them without having to visit a specialist far away. This is kind of our hope, because you all know, going to see a specialist often entails several trips, either to San Francisco or to Santa Rosa, and sometimes Ukiah if you can get there. So about 8 new offices, a lot for admin staff, a huge portion for the behavioral health offices, some for telehealth, and then, like I said, a bigger room that we can hopefully put exercise equipment in, and keep exploring the potential of having physical therapy. I'm not going to promise it with the expansion, because it's a big can of worms to figure out how to offer physical therapy. And yes, David, I saw your hand go up.
Yes, I wondered whether or not you've gotten a new generator capable of.
We did.
Oh, great.
Yes. Yeah, we did get our generator installed, actually just in time for fire season, this past fire season. So we've put it to the test a little bit, and it powers our whole building. So that was really exciting.
Great.
Yeah. So somebody asked if we need a new x-ray machine. I mean, so this was kind of part of the question. We have an x-ray machine. It is right now, the software just to transfer it from computer to computer costs about $20,000. So we did look into, do we want to buy a small portable x-ray machine and replace the giant, some of you may have been in that back room where the x-ray machine is, it's fairly large. And that x-ray machine was, we got 3 different quotes, and they were between, $50,000 and $100,000 to get a portable x-ray machine. And for 65 x-rays a year, we just have felt like it's not really worth it at this time. So we haven't really pursued that. Okay, and side RX and blood draw, is there anything that you wish you could offer but can't offer aside from PT? So I think people are very interested in alternative medicine and holistic healthcare, and acupuncture has been wildly popular. So it would be great to have 2 rooms, and that's part of the expansion. Melanie could use 2 rooms and offer acupuncture to double the amount of patients, but we don't have the space for her to have 2 rooms. So kind of boosting her services, and then also adding chiropractic, I think would be great. And I'd love to hear from you all what you wish was in the Valley and think that we need to add.
Well, I just want to give a big hurrah for the staff that you have is just outstanding. I'm just so
Yeah.
appreciative of, Dr. Rochat. Melanie is incredible. The behavioral health is spectacular. Your nurses, everyone is wonderful. So thank you for
Thank you.
that. I really appreciate
Yeah,
that.
they really are. We've got a really nice clinic family. And we have so many homegrown people, which is nice. People who graduated high school in Anderson Valley and have kind of grown up with us. Ron, I
Chloe?
saw your. Mhm.
Yeah, is there any thought about incorporating our ambulance personnel in some way to help them gain experience by being in a clinical setting?
So Chloë and I have talked about that on and off, more so before COVID, when they were talking about hiring a paramedic and whether we could share a paramedic. We haven't really talked about it since COVID happened. There's always opportunity for collaboration there. I will say, for training, we're really open to having people come and spend a week or 2 with us to get experience. We have had almost every year, minus this year because of COVID, we've had, nurse practitioners come from UCSF. We have one of the residents from Adventist rounding with us right now, actually, for 2 weeks. And she's just getting so much out of our model because it's such a, down home kind of real family medicine practice. They don't get that anymore. The kind of doctor that does house calls and rounds on their patients in the hospital and knows who's in the nursing home and is doing aid in dying, all of that care. A lot of family practice docs don't get that. So, and then the high schoolers, we usually have high schoolers every summer interning in dental or medical, and we love that. And we've hired a few of them. It's good for both of us.
Good.
Say that internship program you do with the students, I've seen a lot of them stay there as employees. That's really wonderful.
Yeah, and it's so good for us because they already kind of know our setting, and they have a little bit of train. We like to train all the high school interns just in how to answer the phones and speak politely to our patients that call, and just that kind of customer service is good for them and great for us when we want to hire them.
They're really sweet.
Yeah. Anybody else have any questions?
I sent you one other question on the chat about your website.
Yeah. Okay. Are we going to have a local fund drive to help with our building program? Yes, we will. So, our we are starting a capital campaign. We've just hired consultants to help us through that process. So we're just getting started on that. Our building project is estimated to cost around 2.5 million, and we have the 1 million match from the federal government. So we're looking to raise, 1.5 million. It's very ambitious. It could be raised over time. That will be okay. But yep, we are going to be starting that in the next couple months.
So would anyone like to be on that committee? Jerry, was that you raising your hand?
Well, and our consultants are just getting started, and they are going to be interviewing some kind of who we call key informants in the community. And if anybody's, interested in at least being interviewed in terms of, knowing contacts and wanting to give input about the messaging for the capital campaign, let me know, because that would be great to have your support on that.
You can also talk to me because I'm on that committee as well. So anybody that would like to join and help us, that would be great. More the merrier, almost.
So I don't know. Yes, Donna.
So, Chloe, I did talk to a resident, an Anderson Valley resident who is a patient at the clinic, and he's over 70, and he had not gotten a vaccine yet.
Okay.
And I just call
Yeah.
the office. And I haven't followed up to make sure that he's done that, but
Oh yeah, please do. And so Fabi and Leah are in charge of our lists. And they are getting really unruly. It is, just the whole behind the scenes thing on the vaccine list has been very difficult to deal with. But if you call and you get through to either Leah or Fabi, you will get on the list if you're eligible. And I'll say we did 120 new vaccines this past Thursday. We're pretty much vaccinating every Thursday, but not always first doses. So this coming Thursday, we have 350 second dose vaccines that we're going to be doing. So we didn't add first doses to that. And then hopefully the following week we'll continue with first doses. So it seems like this is probably a good natural segue into COVID, and I'm sure there's a lot of questions. COVID has been a very interesting adjustment for the health center. You all probably know we kind of shut our doors on March 16th to patients in the dental wing, and then mostly to medical patients who weren't needing urgent care. So we really quickly transitioned to telehealth in a matter of a day or two. A year ago now, and we've been doing really well, I think, with telehealth. Obviously there's patients that can't do telehealth, and so we are happy to see them in person. But it's been quite a transition. So we went to telehealth. Our behavioral health is still 100% telehealth right now, and actually what we've seen from that, just anecdotally, is that patients are pretty happy with it. They're able to have behavioral health sessions with a little more privacy than they were able to have before. So patients who didn't want to walk through our doors to have a counseling session are more comfortable. They can go to the grocery store and have a counseling session in their car. And so we've seen our no-show rates drop. We didn't have high no-show rates, but we've seen our no-show rates drop. And we've also seen a much higher uptake with behavioral health counseling in our Spanish-speaking population. So that's been good. And so we're starting to talk a little bit now that all of our staff are vaccinated about how to transition some, our behavioral health, some of their department back. I can't say that they want to come back in person. They're kind of enjoying this work from home situation. So we haven't landed yet on, what that balance is going to look like. And so that's been such an interesting outcome of COVID, of how people have had to juggle their work-life balance and their kids that are homeschooling, and we'll see how that changes things for the future. And then, so we went to telehealth, and then testing, right? Testing was the big thing. We really need to get testing in the Valley. And so we did testing for a while, once a week, through the county, until that UCSF contract fell through. And we do have the ability to do, we have always had the ability to, and kept testing. Sorry, that's my dog playing in the background. This is the whole work from home balance, right? So we've had the ability to test people who are symptomatic in our clinic all along, and we've never stopped doing that. But the asymptomatic testing has been more challenging. We have the ability to do it, but we've been really trying to work hard with the county to get them to come. And as you know, it's been really spotty. The state wanted them to spend 8 hours in every single community that they go to. So it's right now it's looking like, once every 5 weeks. So the county is still in negotiations with the state as to how often they can go to a community and how much time they have to spend there. And we're hoping that they'll get to come a little bit more regularly. And so vaccines, so we've been vaccinating since January. We started with all the EMS and our, the medical staff, and did that pretty quickly and got all the volunteer fire department vaccinated. And then when things started to open up to, 75 and older, we have worked our way down that tier. So for our patients, we have been reaching out to anybody who was seen in the last 2 years. So that can be one of those reasons why, a 70-year-old patient hasn't been contacted if he hasn't by chance been seen in the last 2 years. The other thing is we are calling a lot of people, and a lot of people are not picking up phones or don't have answering machines to leave messages on. So we take notes of, when we've contacted people. So hopefully, with this case, Donna, he'll just get through to one of us and then we can get that person vaccinated. So right now we have our hands full with vaccinations. I would say that a question just popped up about wanting to do surveillance testing. We want surveillance testing to be offered in the Valley. We don't have the staffing right now to do both. The vaccinations, just with the way it's rolled out and how fast it's rolled out, it takes us at least 5 days to call every single patient that we get on a vaccination list. So we've got people calling all week long, enrolling people in the vaccine clinics. Then we've got a huge team that comes out and vaccinates on Thursdays. And that's really kind of the only day that we have people who can be out of the clinic, enough people who can be out of the clinic to do that. So we've been really trying not to get back into surveillance testing right now with vaccines and the way they're rolling out, but we may have to. It depends on whether, the county can work something out with the state. Any questions so far about?
Yeah, I just sent you one. Are there any CDC updates on the possibility of us all needing boosters on a regular basis?
No, yeah, we really don't know that. I think the evidence is still out. We're not going to know that, I think, until we see a resurgence of cases among vaccinated people. And then there was a question about antibody tests. We can send antibody tests out. If anybody, is interested in just knowing whether they had COVID or suspects that they had COVID or needs an antibody test, we can send that out to the lab. COVID testers a week ago said they would stop coming unless more people are getting tested. Well, yeah, this is the conundrum. And they have also, we've asked, I'm on 3 county calls every week. And just about every single county call, we say, you've got to get that scheduled to us in advance. You've got to get the word out. We can put the word out for you. We will post flyers. And for the last 3 times that they've come, we haven't found out about it until either the day of or the night before. So this is the problem. I think they would have more people showing up if they got the word out. But I know that the state, the way the state was approving their travel schedule is it was like they would approve on Monday the places that they were going to go to for that week, Monday to Friday. So it's been tough for the county too. Seth.
Yeah. Is that stuff going to be posted to your website as you find them out?
Yeah, and we've been posting on Facebook. So I know not everybody does Facebook. We've been, but I noticed that with Facebook, we get more out because it goes out to Boont Swap and Valley Hub as well. So if you are on Facebook, please follow follow our page. I think you'll get all the most up-to-date information there. And on Facebook, on our website, if we get the testing information in advance, I'm happy to put it on our website, on our announcements page. What we have right now on our announcements page is how to sign up on the JOT form and come for vaccinations. This is Amalia. This is my little 6-year-old.
It's been quite a while since I've had one of those surveillance tests, are they still the same deep nasal exploration that they?
No, thank goodness. Now it's just a nasal swab. So it's like a Q-tip, but not, I mean, kids can swab themselves at schools. It's just in the nose. It doesn't go so far. Yeah. Everybody, I know that was painful. It was painful early days of COVID. There was also a question on your list on about eligibility. So everybody above 65 is now eligible to get a COVID shot. So if you have not been contacted by us or don't know how to get on our job form, just call the clinic and our front desk will put you through to Fabi or Leah and you'll get on our list for the next vaccination clinic that we're doing. And then we'll call and tell you what time to come.
Do you foresee getting the Johnson & Johnson vaccine?
There was a shipment that came into the county. We haven't gotten any yet. And we haven't really, like the county hasn't put it out there for anybody to be able to get those. I think they sent the Johnson & Johnson to the incarcerated population and some nursing home residents that still hadn't gotten vaccinated. They just had an outbreak in a nursing home last week due to people who had been hospitalized and transferred into the nursing home but hadn't been vaccinated yet. So they're trying to get those Johnson & Johnson single shots out to the most vulnerable people. When can we safely travel if we've been fully vaccinated? That is the question on my mind. My husband and I are like, can we just book our tickets to Europe yet and just hope for the best? I think, there's a lot of kind of chatter about that. There are some airlines who are calling for that to be able to fly for fully vaccinated people to kind of waive like the quarantine requirements, but every country is totally different. So the CDC is still recommending, even if you're vaccinated, not to travel unless it's essential. So I'll just put that out there, right? We're still being asked to wear masks and do all the same kind of COVID preventing activities that we've been doing. So no travel, wear masks. But I do think that's going to change quickly as we've seen the cases really drop since vaccinations increased. And then on eligibility, so just back to eligibility, there was a whole list of people under 65 with comorbidities that put them at risk for COVID. And it's a complicated list for our providers to figure out, who is a yes and who is a no. I'm encouraging our providers to be as liberal as possible. And if somebody has a reason to get them vaccinated, to get them vaccinated. And the reason for that is because our county is not in sync. There are other providers around the county that are just kind of letting everybody through. So I feel like if we can get as many people vaccinated in the Valley as quickly as possible, then, hopefully nobody slaps us on the wrist for an extra 100 people that accidentally got vaccinated, with a comorbidity that they didn't like. It's really hard with these strict criteria. And for essential workers, we've all food, all agriculture, logging, what am I missing? We've done all of those people. And then, but the small, the kind of small shops, the county has not given us permission to do small retail, which, we've been saying tourists are still visiting Mendocino County. We had to push really hard for lodging. That was the other one, hospitality and lodging. And we did get them on the list, but the small shops that are still open, they're still not technically eligible.
Mama, what is eligible?
Means they can get the vaccine. Any questions?
Yeah, I'll just ask. The president says by the 1st of May, he'd like to shoot to get, all 18-year-olds and older. Is that going to be a strain for the health center?
Not for us. I mean, Mendocino County has been doing comparatively really well. If you look at Sonoma County and some of the other counties around, how we know the percentage of their population that's vaccinated. And in the beginning, I said that it's getting harder and harder for us to fill our lists. We are having to call, 10, 20 people to get one person signed up for a vaccine now, because people have been able to get it at CVS or get it at a dentist or get it down in Sonoma County. And really, I think I know last week we pushed for the county to open up because it's just really hard for us to fill those lists. And but the problem is that the county can't open up faster than the state. So I think there might be a little bit of a holding pattern for Mendocino County. And there are some highly vulnerable communities in Mendocino County that haven't gotten enough vaccines: Covelo, Dos Rios, Laytonville, Leggett. So I think, the county is going to have to do a little more effort and directing of vaccines up there. Questions?
Yeah, in the long run, are you going to have at the clinic a separate protocol of some kind for people who have declined to be vaccinated?
For our staff or for patients?
Yeah, for your staff and or other patients who are around.
For staff, we didn't develop a separate protocol yet. I'm happy to say all of our staff got vaccinated. We had a couple who were hesitant for different reasons, and as time went on and they saw other people getting vaccinated, they got vaccinated. So we are all vaccinated at the health center. There's not a whole lot different other than our travel policies. So we've been pretty strict. If people leave on air, when they come back to work, they have to either quarantine for 2 weeks or have a negative test after 5 days of travel. And then, of course, we're still all wearing masks, even though the CDC says vaccinated people don't have to wear masks together. But for patient care, because all our patients aren't vaccinated, we're still wearing masks, washing hands, doing all of that stuff. So right now, no separate protocol needed. For patients, I think masks are gonna be in our lives for a very long time.
So that means, you're just going to require everyone to wear a mask.
Yeah.
And not say if you haven't been vaccinated, you have to wear a mask.
Yeah. We don't know how long, like the question before, we don't know how long these vaccines are going to last. So, just to protect everybody, I think the mask is just the simplest way to be really protective. And we really learned that. We had one positive staff member over the last year, and we had 2 staff members that had positive family members living in the same household, sharing a bathroom, who, wore masks the whole time, tried to isolate, but, they were living in the same household, and there was no spread among our staff. So washing hands, wearing masks, keeping distance, it really, really works. So there's a question from Elizabeth about conflicting information about a fully vaccinated person being able to pass on the virus to a non-vaccinated person. What's your opinion? Well, I'm not a medical provider, but there is research that is coming out and saying that a vaccinated person can still have asymptomatic transmission, but there is some evidence that says that it reduces it, by quite a bit, like 95%. But I think the evidence there is evolving also as we see more and more people vaccinated and understand how the virus spreads. I don't know if there's any medical providers, Ron, maybe who have studied this evidence and could give more input.
I haven't studied the evidence, but I think this presumes that a person caught the virus before they got vaccinated. And it was asymptomatic. So it's a pretty small group of people.
Yes. Yeah. And I mean, the vaccines are so effective. 95% is huge. Our normal flu shots are like 50% effective if they've got the right strain. So 95% is pretty outstanding. And then to understand what's happening in that 5% that get mild illness, because most people, even if you get ill with COVID, it has been 100% effective in preventing hospitalizations and deaths. So it's absolutely, it's absolutely protective against the most important thing, right? You can still have mild infection, which, most people are pretty okay with. And you still would need to quarantine if you're symptomatic. So you still should be precautious and quarantine if you have any kind of flu-like symptoms, even if you've been vaccinated.
I
So this
just
means-
saw a study that said, the results of a study that said that if you've been vaccinated and if you, among people who are vaccinated, but who were who had been exposed and were asymptomatic, that 20% of those could pass it along and 80% of that already small population would not pass it along.
Thank you. That's great. So that's pretty small. I mean, that's a really small group.
Yeah. Also, we're going to go, but thank you so much for
Sure.
everything and also for today. Bye, folks.
All right.
So I have a question. It used to be all this time, my son was afraid to come and visit me, feeling that he was going to bring it to me.
Mhm.
But now, once I get 2 shots, which I will soon, it's really, I am afraid to give it to him. I want him to come visit, but it's like the tables are turned. How big a risk is that? I mean, he is not vaccinated at all.
It's not a huge risk for you to give him COVID. What is probably more risky is the travel to you. I
Yes.
don't know where he is, but
No, he's
it's the
in Sacramento.
exposure along the way.
Yeah, he's just in Sacramento. So there's not a big risk of me giving it to him. That's what you're saying?
Not that big, no.
Okay, thank you.
Well, Donna, shall we thank Chloe very warmly?
Yes.
And,
Yes.
Chloe, thank you for everything you do for our community, and thank you for today.
Thanks for
Yeah.
having me. I appreciate it.
Nice closure, Philip.
Afternoon, and your children were darling and very good cooperators.
Thank you.
Thank you,
All right,
Chloe.
bye-bye, everyone.
Yes, thank you so much.
Thank you
Bye,
all.
everybody.
Bye-bye, everybody.
Bye.
Bye.
Thank you, Annika.
Oh, sure. Yeah. Good thing I remembered. Oops. Getting senile already. Sorry.
So everybody who's left on, did everybody like getting a postcard? Did it help?
Yes, it really helped me remember that it was today and what time. So thank you, Philip.
Oh, okay.
I guess you need to send me one next time. No,
There you go.
Okay, great. Thanks very much.
Philip, I can
Philip, I
help.
think it's a great idea that could be used as well in the future. It made a big difference in terms of all the things that AVV offers to have